Hi everyone, so it's Marie Catherine, your girl Nurse Diaries. Hey everyone, so it's your girl Marie Catherine. So I'm the founder of Nurse Diaries UK and I'm also a gynecology nurse here in the UK. So I'll be explaining in this video types of treatment that we can give to individuals who have uterine fibroids. I'll also be explaining the reason as to why black women are at higher risk of developing uterine fibroids and strategies and things that are in place in the community to help individuals who have fibroids. So let's get started. There are multiple different forms of treatment that can occur for each individual. So it's extremely important that these women actually go to their GP and actually hear the different treatment option plans suited and tailored towards them. As each individual, their GP looks at them holistically and meets their needs in that way. One option can be taking something called tranexamic acid. So this medication helps to stop bleeding. So as I spoke about previously, some ladies who have uterine fibroids actually bleed quite a lot. So having that medication can actually help them, and that also can boost their confidence and help them to maybe go out. A lot of females who bleed quite heavy tend to isolate themselves from everybody else just due to the feeling a bit different than everybody else. So that is definitely something which is positive in terms of helping with the complications of uterine fibroids. Different individuals have different sizes of uterine fibroids, and there actually is medication out there to help shrink the size of fibroids to hopefully help these individuals to live their lives a bit better, so improve their quality of life so that they're not in a lot of pain and they're actually able to function with a smaller sized fibroid. Some females do end up having an injection that actually reduces the size, so just like the tablet as well, it's another alternative. And some women actually have surgery to remove their uterine fibroids as well. So there are different routes that they can take as well. So it is really, really interesting, and I definitely advise for women to speak to their GP prior to making a decision, because there are multiple routes that can be taken to overcome this problem. Black women are more likely to develop uterine fibroids than others. So why is this the case? Because a lot of the time we hear that black women are more likely, and sometimes it's not nice hearing it, even as a black woman myself, but it's also extremely important that as black women we actually are educated on these things and actually understand why this occurs, so that we can actually tailor our lifestyles to making sure that we look after ourselves, look after our bodies, and prevent all of this from occurring. So black women are 10 times more likely to have vitamin D deficiency. So vitamin D deficiency is actually something that a lot of women have, and studies have shown that a lot of women who have this deficiency actually tend to develop uterine fibroids. So that's one factor that's extremely important for us to actually understand. I want to promote the health and well-being of women, and I obviously want to promote the health and well-being of black women as well, because it's something that I hold very close to me. But I honestly believe that it's important for us to also understand that we do need to adapt the way that we eat in order to help our bodies. So what is in the community for individuals who already have uterine fibroids? Women who have uterine fibroids, a lot of research is out there now, but not enough. I feel like more research needs to be out there. However, you are not alone. There are many, many women who do have uterine fibroids, and I saw a page called the British Fibroid Trust, which actually do speak about uterine fibroids, has leaflets for people who do not understand exactly what it is, and also has forum chats where people actually do speak to each other, create a community of individuals going through the same experience. I love social media nowadays. I personally feel like social media does help so much with everything, really. If you're going on TikTok, you can find new information. If you're going on Instagram, you can find information. And I feel like we should utilize those platforms. So there are TikTok pages, there are Instagram pages that actually, if you type in fibroids, you can actually find so much information. You can find somebody, maybe even in your local town, that is going through the exact same situation as you, and you can reach out to them, and that's how communities are formed. Helping one another occurs, and people actually live a bit better because they're happier knowing that they actually have somebody that they can speak to about the problem that really does affect them. So I think that is extremely important as well. I hope that you enjoyed this video. I hope you've learned a lot of information, and I hope that you are able to actually say you've learned something new and you're able to share that information with somebody else, because that is how we spread the awareness of fibroids. I hope you really did like this session, and thank you so much for watching.